Diane Johnson is a board-certified diagnostic radiologist specializing in breast imaging. As part of career dedicated to the early diagnosis of breast cancer, the second leading cause of cancer death among U.S. women in the United States, Dr. Johnson expanded her expertise to including lifestyle medicine as a key strategy in cancer prevention. This is really exciting to me. I think it's a new concept, but a very trendy concept right now. In addition to completing a diagnostic radiology residency at the Ochsner Clinic in New Orleans, she completed a fellowship in the Mayo Clinic in Jacksonville, Florida. She added board certification in lifestyle medicine to her impressive list of credentials. Using the latest in breast imaging technology and screening, we can detect early breast cancer when it's most treatable. With a whole foods, plant-based diet, as well as lifestyle modifications, we can prevent the cancer from forming in the first place. Dr. Johnson uses all tools available to provide the best care for her patients, always remembering that we are caring for a whole person, not just a body part or a particular disease. Without taking anything from her lecture, I have tried this. It's a commitment. But it's a good commitment, so I'll just say that. So you guys listen to her lecture because it's really a good thing. When not at work, Dr. Johnson can be found spending time with her husband and 4 children with a focus on outdoor activities such as running, hiking, and playing at the beach in her home at the Neptune Beach in Florida. Her plant-based experience, she is a member of the American College of Lifestyle Medicine and completed board certification in lifestyle medicine last year. She personally follows a whole food plant-based diet and incorporates a plant-based philosophy when counseling patients on cancer prevention and risk factor modification. She's a great friend. Truly my pleasure, Dr. Johnson.
Thank you. Thank you. Thank you. Thank you all so much for coming today. This is a topic, this combines 2 topics that I absolutely love to speak about. Breast cancer, cancer in general, and lifestyle medicine. And I hope that we're going to learn some things that we can apply to our own lives in addition to helping our patients. So without further ado, I don't have any disclosures. I would like to give a note of special thanks to Amber Orman, who's a radiation oncologist in Orlando, and Nigel Brockton with the AICR for helping with some of these slides. So I'll start with our learning objectives. They're listed here. We're going to identify modifiable and non-modifiable risk factors for the development of breast cancer, incorporating the NCCN guidelines for risk assessment, and we'll do a very brief review of AJCC staging. We're also going to describe the role that lifestyle interventions, especially a predominantly plant-based diet, physical activity, maintaining a healthy body weight, and how all of these things come into play in reducing cancer risk. We're also going to discuss in some detail the recommendations that were developed by the American Institute for Cancer Research, the AICR. We will utilize those recommendations to reduce cancer risk at the point of diagnosis, during treatment, and through survivorship. So I'm not going to spend a lot of time on staging, but I want to point out a few things because it really illustrates this concept that we're now more and more thinking about cancer and breast cancer more of a systemic disease rather than just localized to one specific body part. So traditionally, staging was a TMN classification, so based on tumor size, the presence of nodal metastatic disease or distant metastatic disease. But And here's just a brief illustration. I think probably most everybody is familiar with that. But the 8th edition of the AJCC staging started to really recognize that biologic factors of the tumor itself, such as tumor grade, proliferation rate, whether they're ER and PR positive, HER2 positive or negative, and gene expression prognostic panels really do play a critical role in the treatment of cancer. So the clinical utility of these biologic factors has become at least as important as the anatomic extent of disease, which is what we traditionally used to predict survival. So the staging now incorporates 3 parallel groups, the anatomic, the clinical, and the pathologic, and they really do all work together. When we talk about breast cancer, I will say I'm going to focus a little bit on breast cancer, but I will touch on cancer in general. Just because my area of expertise is breast cancer, there will be a little bit of a slant towards the breast cancer, but we will touch on other cancers as well. So the NCCN does have risk reduction guidelines, in case you didn't know, and you don't have to look at this in detail, but basically what I'd like to point out is that when we think about risk factors for cancer, there are modifiable risk factors and non-modifiable risk factors. So there are things that we really can't do much about. I'm female, I'm over 45, those things put me at a higher risk for breast cancer. Also genetic mutations, having had a personal history of breast cancer, your family history can play a role. Dense breast tissue does have an impact on your risk for breast cancer, a little bit of an impact there.